Hello, I'm Jalisa Lynn with the Digital Marketing Team, and I'm here with Dr. Evan Argintar, Orthopaedic Surgeon, Assistant Director of Sports Medicine of MedStar Washington Hospital Center, and Assistant Orthopedic Surgeon for the Washington Capitals and the Washington Wizards. We are discussing baseball shoulder injuries today. And we have a few questions that came in.
Thanks for having me.
How are you doing today?
Very good. Excited to be here.
Yeah. So our first question is, what are the most common shoulder injuries you see from baseball players?
There's so many different types of injuries, but there's certain ones that happen more commonly with specific sports. For example, baseball. A lot of times, pitchers, for example, a lot of the injuries are even position specific. Will have muscular strains, and oftentimes they'll get shoulder instability.
Nice. Okay. And what causes these type of injuries?
Well, a lot of times it's a trauma. It's some type of traumatic event. In baseball, maybe you're sliding into a base, or there's a collision at home plate, or maybe you've been throwing too much.
Yeah.
With sports, there's always some unpredictability. However, other times it has a lot to do with the balance of, for example, the shoulder, specifically the strength or the flexibility. And sometimes if the preparation for sport is not good enough, you can set yourself up for an overuse injury.
Definitely. So what is the typical recovery time for that?
Again, it's very injury specific. Sometimes if it's an overuse injury that's just a muscle strain, that can be 7 to 10 days of some activity modification, anti-inflammatory and ice.
Right.
Other times, if it's a shoulder instability, it can be a lot longer. Sometimes weeks, months, and sometimes even a surgical solution is necessary.
Definitely. And what can athletes do to prevent these type of injuries?
It's all about the prehab or the preparation for sport. For the shoulder girdle, which is the scapula, the chicken wing connected to the arm bone, there are actually 17 muscles that span those two bones. And with those 17 muscles, there's a lot of room to optimize or make better this flexibility and balance of the interplay of these muscles. A lot of it is making sure that the capsule or the sphere of tissue around that shoulder joint remains limber, and a lot of it is making sure that some of the smaller muscles, some of the muscles that are easier to ignore, stay just as strong as the big strong ones that you can show off in the mirror.
Definitely.
The pecs, the traps, the deltoids.
Yes.
Those are the ones that young athletes tend to focus on because you can see them.
Yes.
But the ones that are below and underneath are just as critically important in maintaining good shoulder health and shoulder hygiene.
Definitely. All right. And how about youth baseball players? What are your recommendations for pitch counts?
Well, there are lots of different recommendations, and the reality is that we don't exactly know that the certain number that is safe, or the type of pitch which is safe, and there's lots of controversy about this stuff. What we do know is that if young athletes do anything too much, they can set themselves up for problems in a unique way, often because they're still growing and they have centers or areas in their shoulder that might be more sensitive in certain ways than for that of an adult. If young athletes are having pain, what's most critical is that the pitch count and the pitch type is being monitored. And that's a collaborative process with the coach, with the parents, sometimes with a therapist or with an orthopedic surgeon.
Definitely. And does the pitch count stop after the athlete stops pitching?
Well, not always, and that's something that can often be ignored. It's true that pitchers are throwing harder and more frequently than some of the other positions, and a lot of pitchers are perhaps sometimes the best athletes on the team. So when they're not pitching, perhaps they're in another position in the field. But as a catcher, you're throwing the ball just as frequently as the pitcher, maybe not with as much velocity or accuracy necessarily, but you have to be comprehensive in evaluating the total throwing count, not just the pitching count.
Definitely. Well, thank you so much for your time, Dr. Argintar. And if our viewers have any additional questions, you can leave it in the comment section below. And be sure to visit MedStarSportsMedicine.org for more information.
Thank you very much.
Have a great day.